Singapore has been battling COVID-19 for the last 2 months. And just when we thought we had the virus under control, the unimaginable happened. Cases tripled within 2 weeks, most of them foreign workers.
Give the reassurance that the government will take care of foreign workers during this difficult time.
Talking Point investigates if we are doing enough to manage the situation. We're living in extraordinary times. On 9th April, 2 days after the circuit breaker started, we woke up to alarming news. 287 infected cases, and 70% of them were migrant workers. Since then, the number of infections has been rising. At the time of this recording, close to 1,200 migrant workers have been infected. Now that represents close to 50% of the total COVID-19 infections in Singapore. For the past 8 weeks, we did everything possible to contain the virus. So, why did we not see this coming? My guests, a migrant worker activist, an infectious diseases expert, and a representative from the Manpower Ministry, all dialed in. Deepa, you saw this coming since January. How so?
Working with migrant workers for the past 5 years, we know based on experience, based on our interactions with them, the conditions in which they live, the conditions in which they're transported, and the conditions in which they work. And there's one word to describe all those conditions, which is crowded. So it was not due to some intuitive divinity, but it was just based on common sense that we knew that if there was going to be an outbreak in this extremely crowded community, it would spread like wildfire. We were hoping it wouldn't come to that and praying also, but unfortunately now it has.
I think the writing is on the wall. You have to understand the virus. It respects no age, it respects no social class. The second thing is it thrives on social interaction.
Jeanette, did you see this coming?
I think as early as the start of COVID-19, foreign workers have always been in our minds. And the measures that we've taken to protect foreign workers are in tandem with the measures that are taken to protect the local community. In the beginning, just like the local community, we advised foreign workers on the need to practice personal hygiene, be mindful that if they're ill, they should put on a mask and see a doctor. And when the situation worsens, we then ratchet up the measures. And eventually, when we saw clusters in certain dormitories, we took the decisive action to gazette the entire dormitory as an isolation zone.
The first cluster infection in a foreign worker dormitory was on the 28th of March, but it was only 8 days later that the first dormitory was declared as an isolation zone. Now, why not lock down sooner?
The decision to lock down a dormitory with 14 or 13,000 workers is not to be taken lightly. The workers are concerned, the workers are anxious, and we must be prepared. There must be sufficient strong grounds to take this very drastic measure to lock down a certain dormitory. First of all, we need to be prepared to support the dormitory management team to manage the thousands of people who will be in the dormitory 24/7. Now they need to have the meals in the dormitory, and there are also many higher needs, right? Increase in cleaning, increase in maintenance, and so on and so forth. So I think it is very important that whilst we try to isolate areas where there are already clusters, we have to bear in mind that we must be prepared to support the basic needs and the well-being of the foreign residents in the dormitories.
Am I right to say that what I'm hearing is that the dormitories couldn't be shut down immediately because, number one, the dorm operators could not have been able to manage that kind of quarantine conditions, and therefore the authorities needed time to pool resources together before we could even think about shutting them down?
I think the other reason is we have to look at the infection pattern, right? Where the confirmed cases are coming from. So for example, in a dormitory where there are, let's say, 10 blocks, we have to see where the cases are coming from. In some cases, it is all over. In some cases, it is concentrated in a certain place. So I think there are many factors that we have to take into account before we make the decision to gazette a dormitory as an isolation area.
If the first dormitory had been locked down sooner, would it have made a difference?
Yes and no. You must understand the super spreading event happened in Mustafa. And in Mustafa, you would actually have dormitory workers coming from different dormitories, which means one place, one seeding, going back to many dormitories. So many dormitories will still get hit. That's number one. Number two, if you were to lock down the whole dormitory, theoretically, you isolate the infected cases from the rest of Singapore. That's a good move. But at the same time, you keep those people within mixed up in that 40,000, they will develop symptoms, they will develop infections, and these in turn will interact with one another and infections will spread. So unfortunately, this is the breeding ground for the virus.
What is the worst case scenario if we do not manage this properly?
Once you call it an isolation zone, no one can go in and go out. So the worst case scenario is that everyone gets infected down there. And this will simmer over several weeks.
What kind of implication will that have?
I think it's terrible because number one, the numbers will show up that we have an extra 40,000 cases of COVID-19. Number two, it doesn't show the compassion which we have as Singaporeans. And it really shows that we are separating the foreign workers as a different group of people compared to ourselves. What we ought to do, and I think they are trying to do it very hard now, MOM, is to actually split them into smaller groups so that if subsequent there's any further infections, you only affect a small number, small group each time.
I just want to respond to Dr. Leong's point. I would like to say that it is not just about isolating the workers in a dormitory and period. Right? Even within the dormitory itself, we try to educate the workers that they must observe social distancing. And if they have to visit the toilets, the dorm operator will roster and schedule them so that we will minimize intermingling. I myself was in charge of one of the dormitories that were gazetted as isolation areas. Initially, in the first 1-2 days, the workers may not fully understand, but I was very heartened that by the 3rd day, 4th day, and so on, that they actually do observe social distancing. They really stand, about a meter apart from one another when they come down to collect food. And I think they are getting used to it.
I show you, this is my corridor. Yeah, actually one side is here, opposite side also have. So this one side people use one toilet and the bathroom, so all everything. Many people we use one toilet.
That's why all man is scared. Outside go also scared, toilet go also scared, every place go scared.
There are still some concerns about overcrowding in particular. How are you managing this?
I show you, this is my corridor. Yeah, actually got two sides. One side is here, opposite side also have. So this one side people use one toilet and the bathroom, so all everything. Many people we use one toilet. The opposite side also go one this toilet facility. So a lot of people commonly use this toilet.
Need hand washing, coming, face touching, then that time must be coming. That's why all man is scared. Outside go also scared. After toilet go also scared. Every place go scared.
Jeanette, we've seen that conditions have improved in the isolated dormitories thanks to measures taken by MOM. But I understand that there are still some concerns about overcrowding in particular. How are you managing this?
I think people continue to get the impression that there is severe overcrowding in the dormitories because of certain videos that are being shared. But the situation in the dormitory is a lot better right now. The workers are observing social distancing. They are keeping to where they should be within their rooms. So I think we are managing it well.
We're not hearing much from workers within the isolated dorms. But what we need to point out is that there are lots of other lodgings for migrant workers in Singapore. They're not just the dorms in isolation. We are hearing, mixed reports. It's been very emotional, very draining for us. So my volunteers and I have been sort of at it nonstop for the last 5-6 days, or maybe even longer. And I have to say that for very many of us, we haven't slept much, we haven't eaten much. I hope I don't burst out crying on this interview, because we hear the voice messages that are left for us. We see the videos that are shared with us.
Tell me about these voice messages that the workers sent you.
Well, the voice messages are basically plaintive calls for help with food.
Please help me. Now I stay my house, totally cannot go out. I need to food. Boss also no take care, just keep in house all the worker. Please help, I need food, please help. Please help.
You have to understand a lot of them, and again, this is all, in the non-isolated dorms, are feeling very vulnerable at the moment, right? Because their work permits can be cancelled, and once their work permits are cancelled, then they don't get paid. So they're very, very scared about us revealing their names. Now, not all workers are in that plight. From some of them, we're getting news saying, "Madam, thank you so much. We are fine. Employer is taking care of us. We're okay. We have food. And madam, you stay safe." And that's what touches our hearts. Even at this time, these workers are wishing us to stay safe.
Jeanette, what is your response to that?
I think we are appreciative, right, that the community has also come in to lend a hand to foreign workers. We can't do this alone. We need many organizations to lend a hand to reach out to workers who might have been not so well taken care of by employers. If the employers are not towing the line, not chipping in, we will make sure that employers play their part in maintaining the workers. It is their legal as well as their moral responsibility. I would also like to respond to Deepa's point that the workers can similarly trust the Ministry of Manpower. That is that if they come to us with a problem, we will also make sure that they will walk away with a solution. And I think that is what we have been doing.
Dr. Leong, is there a medical case for testing all of the workers and then segregating them according to the test results in a bid to contain the virus?
I wish there was, but there isn't. The problem with this virus is it's very sneaky. You can imagine that there are 14 days of incubation period. If I'm negative on the first 4 days here, it doesn't mean that he will be negative later. In other words, you could be tested negative today, but positive 2 days later, and you could still spread. So there's no one cure-all, search-all solution. Rather, the way to stop this transmission is to stop all social links. This virus preys on all social interactions. If we cut off the social interactions, we kill the virus.
Jeanette, my next question is, at the moment we seem to be having new dormitories shut down by the day. So why not bite the bullet and shut them all down?
There may not be a reason at this point in time to shut down every dormitory.
Why not? Wouldn't it be more effective to shut down all of them once and for all?
I think right now we are taking quite separate action. In dormitories where there are clear clusters, they are put under isolation. So the workers can't leave, they stay in their rooms, and we minimize interaction amongst workers in the isolation areas. But in the non-isolated dormitories, there are other measures in place. Unless they are workers of essential services, otherwise they cannot leave the dormitory. The dormitory operators ensure that there is no intermingling, that there is social distancing, and there is no mixing of workers between blocks and, if possible, between levels. And the workers in these non-isolated areas are given time to do their cooking as rostered by the dormitory operator.
Dr. Leong, is that sufficient? Is that good enough from a medical point of view?
From a medical point of view, I want if possible, an absolute shutdown, where there's very little mingling between people outside their own rooms and within their own units. But you must be very cautious. If you try to lock down all these people, they will have their own cabin fevers. They'll be frustrated, they get upset. Medical side wants a good lockdown, and it makes logical sense. But you have the struggles of people saying, I refuse to be locked down because I don't have my basic amenities and the things which I'm used to. So it's a tussle between these two. It's a tug of war.
Singapore should treat this as a wake-up call to treat our indispensable foreign workers like a first world country should, and not in the disgraceful way in which they are treated now. Do you agree?
Ethic have, but all man is scared, man. If I go outside, then I COVID-19 case ready, then my family what happened? Like this, scared. Some men no go.
4 guys and roommate, right? One by one affected. So I am also very scared. Then I call my wife. My wife start to cry.
I want to show you a social media post that I saw by Singapore's Ambassador at Large, Professor Tommy Koh. And let me quote him. Singapore should treat this as a wake-up call to treat our indispensable foreign workers like a first world country should, and not in the disgraceful way in which they are treated now. Do you agree?
I agree with Professor Tommy Koh that we should improve the way we treat our foreign workers. But I do not personally agree that the way we treat foreign workers today is disgraceful. There is a very wrong perception right now that workers are very poorly accommodated. These dormitories are regulated under the Foreign Employee Dormitories Act, and the Ministry of Manpower licenses the dormitories. We conduct audits, we conduct inspections, and where they fail, enforcement actions will be taken against the dormitory operators.
I think the point he's trying to make is that the condition we need as a nation and as a community, pay closer attention to the way these workers are treated, and we need to improve those conditions. And I can't agree with that more. We've been hearing reports of difficult living conditions, and at this point, the least we can do is to be true to ourselves and be true to what we know, space up to it, and make a pledge that when we recover from this crisis, we will do better for these men who come and build these buildings for us.
Jeanette, hand on heart, do you think there is room for improvement?
Of course, I agree with Professor Tommy Koh as well as Deepa that we should treat the workers better. We can provide them with better living conditions and even employment conditions. And the employers need to play a much bigger role. As a community, we need to show appreciation, acknowledgement, acceptance, and we need to welcome them as a society. They are really part of the Singapore landscape.
What does it take to have more space between the beds, more toilet facilities, and better sanitary conditions?
We could reduce the density of people staying in the dormitory. This decision is taken by a number of agencies. I think we would all appreciate the fact that we are land scarce, and we do need also to reduce the density in the heartland. So there are many factors that we need to take into account. We will need a thorough review from all agencies if we think that we are going to bring the housing of foreign workers to another level. But I must say that as it is right now, I am confident that they are provided with what is needful as acceptable accommodation.
Deepa, what is your vision for the foreign workers when it comes to their housing?
My vision, Diana, is that should there ever be any kind of a video taken anywhere in Singapore where foreign workers are accommodated, there should be nothing in that video that any of us are ashamed about. That is my vision.
Who has the most important part for changes to happen?
Those who have the power to make changes happen have the most important part. But there are also other players that can come in, such as groups such as ourselves. One suggestion I would like to make is that when we move past this crisis and when we take a deep, hard look at what the living conditions for workers should be, I hope we assemble a team that includes some migrant workers. Because who better to talk about what they need than they themselves? A lot of these men are actually graduates. They come here to to earn a living, but they're graduates, they're well-spoken, they're very intelligent. Why don't we assemble a team that includes their voices in what their greatest and gravest needs are?
What's your response to that, Jeanette?
We would definitely welcome the suggestions and feedback of people who are directly affected by the changes that we are attempting to make, the foreign workers themselves. Yes.
Do you think the government should take the lead, Jeanette?
The government should take the lead, but I think in order for changes to be effected, we need the employers to be in the picture as well. There is no point rolling out many requirements when we don't have buy-in from the employers. The employers themselves need to see foreign workers as an indispensable part of the workforce, to be valued as well as to be treated well.
One more stakeholder, Jeanette, for me is the dormitory operators, and that perhaps they should look at the situation as housing men, not just numbers. It's not just 60,000 of them to be housed in how many floors, but really these are all men who have families, who are sons, who are fathers, who come here to help us build our country. Thank you very much, both of you, for joining today. I hope that after COVID, we will see real change in migrant worker housing. For now, let's help to ease the load on our healthcare workers. Stay home, everyone.